us are familiar with the hypnotic state as well as the therapy we are giving under hypnosis. We have different approaches of hypnotherapy.
Sir, थोड़ा सा loudly आवाज.
Okay.
हाँ जी सर, थोड़ा सा volume.
एक अभी देखना, मैंने निर्णय कर लिया. अभी ठीक है क्या? आवाज कम आ रही है अभी भी?
अभी ठीक है सर, अभी ठीक है.
ठीक है.
अब ठीक है सर.
जी. So we are already, most of us are already familiar with the state of hypnosis as well as the kind of therapy we give under hypnotic trance. We have different approaches of therapy which we utilize to address the issues presented by the clients. Here I conceptualized in this lecture, that let us review. In fact, it will be a review. What kind of phenomena get manifested under hypnotic trance, and how can we utilize, or how do we utilize those phenomena for the goal of therapy, as well as what kind of experiments have been conducted in various phenomena, and how can we plan researches using those phenomena. Hypnosis as a state, by default, it gets manifested in multiple phenomena by default, as well as there are some hypnotic phenomena which we induce through the suggestions. The key in hypnosis and hypnotherapy is the suggestions given by hypnotherapist. Suggestion is the medicine we have. I say that as a hypnotherapist, we ought to be expert in the arts, science, and skills of giving suggestions. It is our suggestions that heal the patients. And I would like to show you a brief clip, YouTube clip, which will show a few phenomena which are seen under hypnosis. I'm sharing the screen. Voice is not important here, just see the various phenomena. These are the phenomena which can be elicited during hypnotic trance. See the gap between legs and head. See the rigidity. Automatic rotation movements. These are a few phenomena, mostly motor phenomena. These were some physical and motor phenomena which we can see under hypnotic trance. And whatever form of psychotherapy, hypnotherapy we conduct under trance, we utilize one or the other phenomena which are suggested or manifested automatically during hypnosis. The simplest phenomena is the enhanced suggestibility. We all know that hypnotic state depends upon the suggestibility, quality of suggestibility of the client. If a client is highly suggestible, he gets into hypnotic trance quickly and in deeper trance. And if suggestibility is low, the trance level is also mild. And in this context, I would like to highlight that this classification of high, medium, or low depth of hypnotic trance and suggestibility, they are contextual phenomena. If a person shows high suggestibility in a particular session, the same person may come present with lower levels of suggestibility in subsequent sessions. A person presenting as low suggestible on a given date may present with high suggestibility on next date. It is not a fixed manifestation across the sessions, across the therapies. Then coming back to the phenomena of suggestibility, what do we do in hypnotherapy? We use suggestions for inducing the trance, deepening the trance, testing the trance, as well as utilization of the trance. That is therapeutic utilization of the trance. In therapeutic utilization, we develop a script based on direct suggestions or indirect suggestions. By using various scripts for specific to the issues presented by the client, we simply give suggestions, and these suggestions get manifested in the desired behaviors. This suggestibility.
Just one moment, sir. Are you presenting a presentation, PPT?
Without presentations.
Because we are not seeing that. I thought
no presentation. Sometimes I'll be sharing.
Thank you.
Sometimes I'll be sharing my browser.
Sorry to do that.
So the suggestions given to the patient rest. It is hypothesized that these suggestions rest in the subconscious mind of the patient. And through those suggestions, the desired therapeutic behaviors get manifested. The art of suggestions, there are some points in crafting the suggestions. What kind of suggestions do we give? How the suggestions should be formulated? In the process of working through hypnosis, I realized one thing, that the vividness of imagination is highly important. Under hypnotic trance, the quality of imagination improves, and that imagination gets transformed into actions. If our suggestions are of such a nature that suggestions elicits clear, vivid, unambiguous imagery in the mind of the patient, there is likelihood that the suggestions will be followed. The vague suggestions are unlikely to help. In the conscious state, we sometimes expect that whatever we say may be ambiguous, that the patient will understand what we mean to say. What we mean to say and the analysis and deriving out of it is the activity of the conscious mind. In the PPT is not there. I wanted to prepare the PPT, but I could not find the time despite my wish. So I am presenting without PPT. So through suggestions, that if the ambiguity can be handled by conscious mind, in trance state we need to be unambiguous. What I'm trying to say is that this suggestion that which is understood as uncritical acceptance of the suggestions, that is suggestibility, and this suggestibility is enhanced in trance state. To therapeutically use that suggestibility, we need to be very clear, unambiguous. I remember that even Erickson used to draft thorough scripts, detailed scripts for the patients so that he can deliver precise, accurate suggestions. The next point is the potential of hypnotic mind for age regression. Age regression is conceptualized as accessing the events, experiences, memories of early age. Age regression has become an established therapeutic procedure, and it is made possible because of the memory enhancement which happened during hypnotic trance, the revivification, the reliving of the experience. The concept of age regression, it has been studied both experimentally and therapeutically. You must have read or heard that in age regression, a person is taken to the previous ages through suggestions, is guided. Suppose a person is of 25 years age, he is asked to write his name under hypnotic trance, he will write very clearly, legibly. Then take him back to the earlier ages, say 10 years, again he can write clearly, 5 years, 3 years, 2 years. There will be a point that he will not be able to write his name clearly if it is a preschool period. So it suggests that during the process of age regression, the mind enters the ages to which the therapist guides. Also, there are studies in which intelligence level is determined according to the age. For example, a person of 25 years, he is giving an intelligence test relevant to the age of 25 years. Then 15 years, the test relevant to the age of 15 years. Then 10 years, 5 years. It is seen that the person under age regression demonstrate cognitive features of earlier ages. Now, there is a question. The question is, if a person regresses to the age of 5 years, whether the totality of his mind, the totality of his being gets back to the age of 5 years, or he remains connected to the adult level. The recent studies show duality that in the sense that the person at the adult age and the person regress to the 5 years of age, he maintains reality of both ages. He can display behaviors relevant to the early ages as well as behaviors relevant to the current age. Our emphasis for therapeutic purposes is regression, the duality which presents itself of earlier ages. The hypnotherapists use age regression both for diagnostic purposes as well as therapeutic purposes. Diagnosis is extremely important to understand the dynamics of the present symptoms, the determinants of the present symptoms. In psychoanalytic orientation, it is understood that the earlier patterns of experiences, what we were understanding in ego state therapy as well, that the earlier patterns of experiences, interactions, they do determine present behavior. So in age regression, we need to understand the age and the experiences which led to the current symptoms in the current time. I was reading a case, a lady, married lady, she was pregnant. She was a student of psychology. She became extremely worried regarding her child, that in early ages, early life experiences, her mother had treated her badly. There was emotional starvation, there were emotional problems, interpersonal problems with the mother. She did not consider her as reared affectionately. And she was particularly worried that if she delivers a child, she may repeat the same behavior what her mother was doing to her. She may enact the same scenario and provide the similar kind of experience to the child. So what to do? In hypnotherapy perspective, age regression is the right procedure in which the hypnotherapist regressed her to the previous age. And there is one more phenomena which get manifested in hypnosis that we call hallucination, positive hallucination and negative hallucination. Positive hallucination is the perception of an object which is not present in external reality. He created a person, an elderly person in her childhood. And that person got created in the mind of the client because one, this hallucinatory experience, number two, dissociation, and in terms of ego state, a different ego, adult ego. So the therapist was dealing childhood experiences in age regression by providing a supportive, caring, adult personality to correct her emotional experiences. So the therapist regressed her to the early age and made her to interact with the supportive, caring adult person in her trance state during regression phase. And with this therapeutic procedure, this lady was able to overcome her anxieties which stemmed from early childhood experiences. For diagnosis of problems means the determinants of the symptoms, the dynamics of the present symptoms, we conduct age regression. The age regression can be a verbal through interactions and through non-verbal methods, ideomotor questioning. The first point is to determine at which age the problem started. It is done either gradually, year by year, blocks of years, or simply go to the time when this problem originated. Very simple suggestion. Under hypnotic trance, go to the time when this symptom originated. The person accesses subconscious mind. Hypnosis provides a special platform which makes a person to access the subconscious mind. The experiences, memories of early childhood are retrieved relived. Here I want to make a difference. The experiences as memory, as relived experiences. Memory recall is a simple cognitive activity which an adult ego performs. Regression proper is that the person under regression phase feels as if he is reliving the experience, again experiencing the same events. So when a person gets access to the earlier experiences, then a connection is established to the present symptoms. If that connection is relevant, we clinically hypothesize that those particular experiences are relevant to the present symptoms. That means a proper diagnosis is formed, diagnosis is formulated. Unless we formulate this diagnosis, it may be difficult to work even through age regression. So we must have a pinpointed experiences. There may be one experience or series of experiences. If there are series of experiences, we try to regress to the person, to the first experience, the seed experience, initial experience, which sensitized his mind, which made him vulnerable for further experiences. So having ascertained this diagnosis, we need to address and resolve the issues of the past. So when we are applying hypnotherapy, we are using multiple hypnotic phenomena. As I said, hallucination, dissociation, age regression. So by using various hypnotic phenomena under hypnotic trance, we can successfully achieve our therapeutic goals. Next, the phenomena of analgesia and anesthesia. Regarding this phenomena of anesthesia, it is known since centuries. I would like to recollect a very good experience of the past. There was a Scottish surgeon working in Howrah Hospital in 1840s. That time, mesmerism, this hypnosis was known as mesmerism. And he learned mesmerism. Chloroform was not invented, no anesthesia was present. And since he was a surgeon, he used to do operations. And in India, he was using anesthesia in the patients. Anesthesia can be induced under hypnotic trance. And by inducing anesthesia, he was performing both major and minor surgeries. So he found that by using hypnotic anesthesia, he was having 50% more success. There was less mortality. And there were less post-hypnotic infections, post-surgery infections. He successfully used hypnosis, the phenomena of anesthesia, which get manifested under hypnotic trance. He did it. Now the research questions which originate from this phenomena of anesthesia, those studies are being conducted, sophisticated studies are being conducted, that chemical changes in the brain functioning under anesthesia, how it happens. So if we have sophisticated instruments, sophisticated devices, the research facilities, we can induce anesthesia and find out what kind of changes are taking place in the brain brain physiology, which account for this marvelous phenomena of anesthesia. Though surgery is not common nowadays, but isolated cases are there. Exceptionally, some surgeries are performed under hypnosis. Also, the childbirth is being done under hypnotic trance. Again, this manifestation of the same phenomena of analgesia and anesthesia. How do we do that? How do we induce anesthesia, analgesia? Alok sir performs frequently the demonstrations. He will hypnotize the subject, insert needle under the skin, and without any pain, without any recognition. So the anesthesia offers an opportunity for surgical operations. Analgesia is important. Analgesia is reduction in the pain. Anesthesia is almost elimination of the pain, but in analgesia it is not elimination, it is reducing the pain. And regarding pain, it is a well-established concept that pain is the messenger of some other problems in the body or mind. We do not indiscriminately remove the pain of the client, because pain management, if removed through hypnotherapy, it can obscure the detection of actual pathology which may be building inside the body and mind. We need to find out what are the real causes of the pain and then treat those causes. But in case there are situations when reduction in pain is required, there are many conditions which present with severe pain, persistent pain, headache, migraine, different type of pain. There is an associated procedure, the associated phenomena, we call it time distortion. In time distortion, time can be expanded or time can be shrunk. So how do we do time distortion? Suppose a clock time of 1 minute. It can be extended to hours, days. A 5 minutes clock time can be reduced to seconds. This is the quality of the phenomena of time distortion. Sometimes I use time distortion for relaxation. There are patients who undergo hypnotic trance, and while trying to recover from the trance, they are reluctant to come out of the trance. They say that I'm enjoying the state. I don't want to come out of this state. I'm feeling very good, very relaxed, in bliss. I want to remain there. So what do I do? Okay, you sleep, you take rest, sleep, enjoy the state for as many hours as you want, maybe 4 or 5 hours. And with a gap of some moment, I will say 1 second is equal to 1 hour. Keep enjoying for 4 or 5 hours. 1 second is equal to 1 hour. And after a few seconds, I ask them, do you want to come back now? Yes. So when after awakening, I'll be taking feedback, how many hours you slept? They will say 4 or 5 hours. So this is the demonstration of the phenomena of time distortion. Then how do we use, along with the phenomena of analgesia? A person is having pain. We need to induce the analgesia. And we want to club it with the phenomena of time distortion. A person, for example, has pain for several hours a day. So under hypnotic trance, we can give a post-hypnotic suggestion that you experience the pain for as many hours as you want. maybe again 5-6 hours, and 1 hour time is equivalent to 1 second. So you will have about 5 seconds to experience all your pain of 5 hours. This has been done in case studies. I'm citing from there that within 5 seconds, he can experience an intense pain of 5 hours. And in a normal day-to-day life, he can, whenever he has that sensation of pain, he can just simply slip into hypnotic trance. The post-hypnotic suggestion what we give to the patient takes the person in hypnotic trance during the moment when post-hypnotic suggestion is executed. When we say that in 5 seconds you will be experiencing pain of 5 hours, 1 second will be equivalent to 1 hour. That means during those 5 seconds, he will pass into hypnotic trance. And to others, he may be in a meeting, he may be along with among his family members, he may be working with something, and for 5 seconds or like that, he will pass into the hypnotic trance, he will experience that pain, and he will come out of the trance, and will there is another associated phenomenon of amnesia, and he will forget what happened to him. So that shrinking of time, and if you want to lengthen the pleasant time, for example, a person who remains chronically in anxious state, stressful state, and for some time he feels the normal state, happy state, through time distortion, we can extend this state, say 1 hour of happiness, extending to 5 hours. So this idea, this phenomena of time distortion has great capabilities for therapeutic purposes. So it can be done with analgesia, it can be done with pleasure, the stress reduction, pain management, it can be done easily. Then I want to add something, then how do I induce analgesia, anesthesia? I will simply say under hypnotic trance, the part to which I indicate, maybe a palm, maybe head, that it is, imagine that there is a ice on your skin, touching your skin, the skin is becoming numb, there is no sensation on this part of the skin, and then I can pierce the pin to test whether there is anesthesia present or not. The next important phenomena is amnesia. We make a distinction between forgetting and amnesia. Forgetting, we refer in day-to-day usage, forgetting the events of day-to-day life, which can be explained ordinarily, which happen to most of us. It's a normal phenomena, forgetting, memory and forgetting. Amnesia is forgetting of such an extent which cannot be accounted for by ordinary explanations. In psychiatry, there is a symptom of amnesia, we call it pathological forgetting. So instead of using that pathology term, we understand amnesia means forgetting such an event which is not ordinarily expected. How do we demonstrate experimentally the phenomena of amnesia? Very simple. To a subject under hypnosis, I will say count 1 to 10. He will count 1 to 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then I will suggest the number between 5 and 7 is missing. You have forgotten it. The harder you try to recall it, harder you will miss it. And then I ask the subject, count 1 to 10. You will count 1, 2, 3, 4, 5, 7, 8, 9, 10. Then this is called amnesia. It is not pathological, but it is suggested amnesia. Amnesia simply means forgetting. Amnesia, I've seen in cases that amnesia of hypnotic experience, that is the experiences which a person has under hypnotic trance, it manifests in various ways. The simplest is spontaneous amnesia. Spontaneous amnesia means forgetting the experience of hypnosis automatically. There will be some patients to you that they say that they are not able to recall anything. They don't remember anything. This is spontaneous amnesia. Then suggested amnesia. Suggested amnesia is, we say that you forget the events, what you are experiencing in the hypnosis. This is the simple suggestion, but if you use some kind of imagination and metaphor, it becomes more pronounced. Likelihood of acceptance of this suggestion increases. Let us raise a curtain on the events, whatever you experienced during hypnosis, that we created an imagery, also the metaphor that the events are behind the curtain. So this is suggested amnesia. Then amnesia can present itself in a globally. Globally means the total hypnotic experience is forgotten. Partial amnesia, some of the experiences of hypnotic trance are experienced and some are forgotten. So there is one more dimension to the amnesia, temporary amnesia and long-term amnesia. In temporary amnesia, the experiences of hypnosis will be recalled after a time gap. And in long-term amnesia, events are not recalled even after months, years. Milton Erickson was a great hypnotherapist, in fact. He had opinion that after hypnotherapy session, if we immediately discuss the hypnotic experience, what happened in the trance, what was you feeling, what were your experiences, what thoughts you were having, what visualizations you were having, questioning in this manner, that means we are not allowing the amnesia. All those events will come in the forefront and the conscious mind. When we operate on the idea of subconscious mind and conscious mind, subconscious mind, we say that it is not accessible to the conscious mind directly. And the experiences of subconscious mind exert their influences while the experiences remain in conscious mind, unconscious mind. And if our intention is that the hypnotic experience should reside in the subconscious mind, it should not come to the conscious mind, because if it comes to the conscious mind, it can lose its therapeutic potentials. If that is the scenario, that is the context, then we should raise a curtain so that the experiences remain in unconscious mind and exert their influences in the behavior, emotions, and actions. And Milton Erickson used to actively encourage amnesia. After awakening, he will talk something other, something not related to the hypnosis, not related to the trance, not related to the problem of the person. And I find that this is useful. Of course, there can be some scenarios, some situations in which the recall of unconscious experiences is beneficial to the client. If he retains in conscious mind, it can have a therapeutic advantage. Then only we encourage that amnesia is not there. So amnesia is used for therapeutic purposes. If we connect it to the age regression phenomena, under age regression, we usually find highly traumatic experiences, painful experiences of the client, which ego is not able to deal with. Since ego is not able to deal with those experiences, overwhelming to the ego is protecting access of those experiences to the conscious mind, from unconscious to conscious mind. And if we trigger those traumatic experiences and we bring the person with those traumatic experiences in conscious awareness, those experiences can potentially interfere in the life of the person. So for proper therapeutic utilization of regression, the painful experiences of the regression and the phenomena of amnesia, we need to clinically determine whether during the age regression, the elicited traumatic experiences are adequately dealt with. The person is not going to get disturbed if a person retains in the conscious mind. Then only amnesia is not induced. Sometimes, in the interest of the therapy's goal, we say to the patient, come out of the hypnotic trance with memory of all these experiences. So the utilization of this technique, this phenomena, you need to have a sound clinical judgment. Suppose we made an error. We brought the person with those memories, traumatic memories, and person is feeling disturbed, restless. We are not helpless. Persistent of those hypnotic experiences in the conscious awareness, exerting influence negatively on the person, that means some amount of trance is still persisting. We can take the person once again to the hypnotic trance. Under trance, again give the suggestion of raising the curtain, forgetting कि ये experience जहाँ से आए हैं, जहाँ आए वहीं रहने दीजिए. You will come out of hypnotic trance by forgetting all these experiences. So we can undo the problems which was caused by recall of those experiences. So this amnesia can also present us research potentials. In India as a whole, we are conducting negligible scientific researches in the field of hypnosis. You must have seen that there is a Society of Clinical and Experimental Hypnosis, Journal of Clinical and Experimental Hypnosis. Both clinical and experimental hypnosis go hand in hand. So we need to come out with the ideas so that we can promote high quality researches in hypnosis and hypnotherapy. The immediate research question in my mind is that which kind of patients present with spontaneous amnesia, which kind of patients respond to the suggested amnesia, what are their unique features? what is there in their hypnotizability, suggestibility, which make them different. Post-hypnotic suggestions are extremely important. Let us first try to understand the structure of post-hypnotic suggestions. The idea of post-hypnotic suggestion is that the suggestions are given under hypnotic trance with the goal that the suggested behavior will get manifested after termination of hypnotic trance. There are three aspects, distinct aspects of the suggestions while crafting the suggestions for post-hypnosis. Number one, there should be a cue. A person was having problems with oral examinations, Viva, we call it Viva examinations. What is the cue? The setup of oral examination. That is the cue. The present behavior, he becomes highly anxious. He is knowledgeable, he is learned, he has studied well, he is capable of expressing himself, but due to prior conditioning, he developed a specific anxiety for oral examination. So oral examination is the cue. What would be the prescribed behavior? That when you are in the oral examination, you will find yourself extremely relaxed, calm, composed. You will be able to attentively listen to the questions of the examiner. With a cool mind, with composure, you will be able to answer all the questions, whatever you know. You will remain throughout the procedure comfortably. Number one, cue of suggested behavior. Number two, suggested behavior itself. And number three, suggested amnesia, that you will forget I gave you this suggestion. The execution of post-hypnotic suggestion happens as it is, as prescribed. I give a very good example that there are a few examples of which can be shared vividly, clearly. In my early ages, when I was demonstrating hypnotic phenomena in classroom setting, in a college, I was invited to volunteer. I gave a very clear suggestion that after coming out of this state, I will be asking you, what is the time? Instead of telling me the time, you will get up from the chair, go towards the blackboard, pick up the chalk, and write your address and come back. You will forget that I suggested it. I told you to do so. So there are three things. Number one, a cue. What is the time? Time is the cue, asking time. The suggested behavior, go to the blackboard, write your address, and come back, and you will forget that I told you. Then after hypnotic trance, after a gap of few minutes, I ask him, what is the time? Immediately, the quality of execution of post-hypnotic suggestion is that the person compulsively complies to the suggestion. He got up from the chair, went to the blackboard, picked up the chalk, and wrote his complete address on the blackboard and came back, sat on the chair. Cue, he responded to the cue, he executed the behavior. And third, I asked him, I told him that I asked the time. What did you do? कि सर मेरे पास घड़ी ही नहीं है. तो घड़ी नहीं है, ये बात तो पहले भी कह सकते थे. But what did you do? Why did you do that? You went to the blackboard and said, I don't know. I don't remember. See the potential of this hypnotic phenomena. There is suggestion, bind to the cue, and the amnesia, and the compulsive execution. What do we strive for in hypnotherapy? We do hypnotherapy, we deliver the suggestion to the patient under hypnosis. What is our expectation? To respond to those suggestions during the therapy or after the therapy? It is obviously after the therapy. We expect the person to comply, to enact those behaviors suggested under hypnotic trance after termination of the trance in his daily life. So this can be utilized in various ways. The simplest way is that to a person who remains in stress and anxiety, stick something on your, say, fridge, a magnetic object, stick on the fridge. Whenever you see that object on the fridge, you will find that a wave of relaxation is spreading throughout your body. Very fast, instantly. There is a cue, there is a suggested behavior, and again amnesia that you will forget, you will not remember that I told you to do so. So this is one example where post-hypnotic suggestion can be utilized to deal with stress and anxiety, because what do we do in a relaxation procedure? Relaxation procedure, we make the person relax in our clinic. That takes about 10, 20, 50 minutes. After that, he gets back to his own life, and again that symptoms manifest after some time. It does not have a lasting effect. There should be a repetitive experience of relaxation. Then how can we induce those repetitive experience and within a span of a few seconds? By binding that relaxation suggestion to some cues. This is one example where specifically we can use the potential of post-hypnotic suggestion for therapeutic purposes. Like in that oral examination, there is an oral examination. You will be sitting before the examiners. There will be a number of examiners. You will maintain your calm. You will be calm, composed, relaxed, unhurried. You will find yourself comfortable. You will listen attentively to the questions, answer the questions comfortably. There is a cue and there is suggestion. This can be dealt with any stimulus bound. Such type of suggestions can be helpful in stimulus bound anxieties. For example, for cases of phobia, there is a dog phobia. Again, you will be exposed to the, whenever you encounter a dog, you will find yourself relaxed, uncaring. So there is a stimulus, there is a suggested behavior and amnesia. And this potential of post-hypnotic suggestion, we can use it creatively. I like the term that creative therapeutic thinking. Regarding the homework, in psychotherapy, we consider that most of the therapeutic gains are achieved between sessions. That means whatever homework we provide to the patient. In hypnotherapy, we provide homework of relaxation, listening to the tape, engaging in certain activities, coming to the follow-up. So we can use this potential of post-hypnotic suggestion for this phenomena. One of my colleagues used to suggest that whenever you come for the next session, you will find that your symptoms are reduced by 50%. Like this. This idea the most used phenomena is this post-hypnotic suggestion for persistent benefits. So we can creatively identify activities, behaviors, cues relevant to the condition, symptoms of the patient, and use them. Simple example, there are patients who forget their medicines. There are patients who are on regular medications 3 times a day, 4 times a day. For a few days, they will be aware, conscious, and be taking. And after some days, you will find that they tend to forget their medicines. But they need to take medicines regularly. Hypnotherapy has multiple dimensions. Hypnotherapy stand alone can be a therapy, sufficient therapy. Hypnotherapy can be an adjunct form of therapy. A therapy with other forms of therapy, medical therapies, maybe allopath, Ayurveda, homeopathy, whatever is the therapy, we can add hypnotherapy with other therapies also. And we can use this adjunct uses that directly we are not able to address the symptom of the patients, but we can certainly suggest those behaviors which will help the patient to recover or to manage the condition effectively. It may be suggestions maybe for the exercise, for taking medications regularly, doing yoga, or the suggestions I told you that next time you will be having, you will report that you are having at least improvement, 50% improvement in your symptoms. And another creative and very powerful use of post-hypnotic suggestion is that in the coming week, you will be having very vivid dream, maybe in your sleep or while you are alone, that very a vivid dream regarding your problem and its context, how this problem started. There are some patients, we call it, I think that we wrongly call it that resistant to change, less motivation to change. So in such cases, those who are not opening up, not coming up, they are fixed on their symptoms, they are talking about their symptoms, they are not talking nothing, you explore anything. In those cases, we may prescribe dream. And that dream under hypnotic trance can be induced within the session or after the session, anytime. And if you get a feedback on the dreams, what kind of dreams the patient was having, what was there in detail, you may have good clues to the dynamics of the symptoms. There is one approach also capitalized on imagination. For me, imagination is immensely important in hypnotherapy work. When a person is in abnormal state, pathological state, having symptoms, is most of the thinking, most of the activities, most of the living centers around the symptoms. He will talk about the symptoms. He will talk about the restrictions in his life, his functioning, imposed by symptoms, how his life is badly affected by the symptoms. That means always talking of the symptoms, thinking of the symptoms, feelings related to the symptoms. So that he lives every day, day by day, he is living in the symptoms, thoughts of symptoms. His being remains in the symptoms. So I find it very useful asking the patient, once your symptoms are eliminated, how will be your life? What will be your thinking? What will be your feeling? There is a phenomenon of age progression. Age progression means from here, आज की डेट में आपको symptoms हैं, आप problem में हो, आज से कुछ महीनों बाद, कुछ साल के बाद जब आपके सिम्टम्स नहीं रहेंगे, हाउ विल बी योर लाइफ? क्रिएट अ विविड सिनेरियो. What will be your life? Tell me in detail. What will be your feelings? What will be your activities? What will be your lifestyle? What will be your feeling? How you will be feeling with your stresses? Take a detailed description. Note it down. Put a person into hypnotic trance, and as post-hypnotic session, give the same image, same scenario under hypnotic trance. Why under hypnotic trance? Because hypnotic trance enhances suggestibility. And in enhanced suggestibility, suggestions are accepted uncritically. And there is one extra merit, extraordinary merit in fact, that patient is having the problem, and to me, patient is having the best solution. In counseling, we say, help the client in such a way that he can help himself. He can find the way. If we give our suggestions crafted by us, those suggestions may not sync, may not align to his ideology, his background. If we are inquiring through this age perspective, what kind of life he is visualizing for himself, and we give the suggestions accordingly, that means the suggestions will be acceptable, number one. Number two, the suggestions will be according to his psyche, his emotions, his way of thinking, his vision. So take his vision, give suggestions as post-hypnotic suggestions, and see the change. Create the clear imagination of those patients, those suggestions, so that can help the person to get motivated to move towards the wellness. I say that hypnosis is useful both for illness and wellness. Most of the time we struggle with the illness, removal of the illness. Instead of removing the illness, why don't we address directly the wellness? And what is wellness from the point of view of the patient? Take a detailed note of it and give suggestions. Once suggestions are accepted, those suggestions will be motivating force for him to move towards wellness. That will be guiding force, motivating force for him. This way, there are many more phenomena we need to have in mind that these phenomena are unique to the hypnosis, hypnotic trance. They get accentuated. Of course, without hypnotic trance also, phenomena can be manifested, phenomena can be demonstrated. Hypnosis as such, formal induction of hypnosis is not necessary. But in my understanding, hypnosis gets induced in the process. For example, a person without any formal induction of hypnosis, we want to have an age regression. Okay, go back to your school time. What are you seeing? Who are your friends? Who are your teachers? What you are studying? What about your family? So in the process, when he is directed towards inner explorations, the state gets created. So in that state, he recalls it. And if it is a traumatic childhood, then go back when there were no trauma. Most of the time you'll find the trauma-free period. And with the trauma-free period, create something. Some adult like this February man, he called it, the adult person who can support the individual and move forward. There is one aspect of this hallucinatory phenomena, positive hallucination. In unfortunate events, when there is separation of a family member due to end of life, some persons feels disturbed develop guilt feelings, unfinished business, unfinished communication. बस मैं ये कर लेता, ये बात कर लेता, मुझे बुलाया था, मैं जा नहीं पाया, मेरी इतना बिजी हो गया अपने आप को, गिल्ट फील, सीवियरली गिल्ट फील करते हैं, इवन डिप्रेसिव भी हो जाते हैं। बस एक बार बात करने को मिल जाए, बस एक बार ये बात कह दो, एक बार सॉरी बोल दो. There will be some clients with these painful issues. What we see in hallucination, we create something, some object or person which is not present here. So my strategy is induce the hypnotic trance, find yourself in any spiritual place, highly spiritual place, be in peace, and you find that a person is in front of you. Since that is the agent of the mind to talk to the departed soul, the person is in front of you, you can have a detailed communication, conversation, whatever you want to say, whatever you want to ask, you can do that. This hallucinatory experience do heal these grieving individuals of unfinished business. So I think I would taken much time. Thank you very much, sir. Palan sir, thank you very much. Nidhi, Manisha, Alok sir, thank you very much.
Rakesh sir, wonderful presentation.
Thank you, sir.
Indeed, fantastic. And the last one, what you said was like the empty chair therapy. The
Yes.
last one, spiritual.
Yes, sir.
I
Yes.
got one question to ask you, sir.
Yes, sir.
After this time regress, you said time distortion therapy.
Yes.
Distortion therapy, after we have done the magnet therapy on the refrigerator, and we have done all that, but still the client comes back to us and tells us that I do get the pains. Like the progressive muscle relaxation therapy, can we teach the self hypnosis 1 hour as 1 second to our client? Is it possible? Can we do
Yes,
that?
sir. For self-hypnosis, I usually recommend, sir, taking support of audio program, maybe MP3, anything. So that is always better, sir.
Thank you, sir. Thank you very much. Thank you, sir. Thank you,
So,
sir.
thank you
Yes.
so much, sir. So it was very interesting talk. You said you were using the word hallucination, like we can introduce an adult person or a deity or something. So why are we calling it hallucination and not as normal imagination? Because hallucination would mean there is no contact with reality. Why
Yes.
not just imagination, sir?
Yes, yes. It's imagination presented as external reality. The person is sitting in front of you, actually sitting in front of you.
Okay, not in the imagination, but outside your imagination.
Outside you, on the
Okay.
chair, empty chair. Say there is an empty chair. The person is sitting in front of you on that chair, and you are having communication.
But
There is a blood area in this. We are rightly pointing out. No need to be worried.
yes.
It's like that.
Okay, sir. Okay. Thank you, sir. It was wonderful presentation.